Why does chronic urinary retention happen in the bladder? Imagine feeling like your bladder just can't empty fully, even after going to the bathroom. That's what happens with chronic urinary retention, a condition where urine stays in the bladder over a long period. This buildup can cause discomfort, frequent urges to urinate, or a weak and interrupted stream. It often develops gradually and can be caused by different issues affecting how the bladder functions. The most common reason is a blockage at the bladder outlet. In men, an enlarged prostate gland, known as benign prostatic hyperplasia, can press against the urethra and block urine flow. In women, pelvic organ prolapse, like the bladder dropping into the vagina, can cause similar blockages. Other obstructions include narrowings of the urethra called strictures, kidney stones blocking the passage, or swelling from infections such as urinary tract infections or prostatitis. These obstructions prevent urine from leaving the bladder completely. Another cause involves the muscles of the bladder itself. The bladder muscle, called the detrusor, needs to contract strongly to push urine out. Sometimes, especially with aging or nerve damage, this muscle becomes weak or fails to contract properly. When the bladder cannot generate enough force, urine remains trapped inside, leading to retention. This muscle dysfunction can be linked to nerve issues or chronic overdistension, where the bladder has been stretched too much over time. Nerve signals play a vital role in bladder control. Damage to the nerves that communicate with the bladder can disrupt normal function. Conditions like diabetes, multiple sclerosis, spinal cord injuries, or strokes can interfere with these signals. When the brain and nerves can't coordinate properly, the bladder may not contract or relax at the right times, causing retention. Certain medications can also contribute. Drugs like antihistamines, decongestants, anticholinergics, or muscle relaxants might interfere with bladder muscle contractions or the ability of the urethra to relax. If someone already has an obstruction or nerve issues, these medicines can make retention worse. Chronic overdistension of the bladder can lead to a cycle of problems. When urine isn't fully emptied, the bladder stretches beyond its normal size. Over time, this stretching can weaken the bladder muscles, making it harder for the bladder to contract properly. This condition, called bladder decompensation, can worsen retention and even cause the bladder to fail over time. From a bladder health perspective, chronic urinary retention is significant because it can lead to infections, bladder wall damage, and other complications. When urine stays in the bladder for too long, bacteria can grow more easily, increasing the risk of urinary tract infections. The persistent stretching and pressure can also harm the bladder tissue. While retention itself doesn't directly cause bladder cancer, ongoing irritation and infections associated with it may increase the risk of bladder problems in the long run. That's why early diagnosis and treatment are so important to protect bladder function and overall health. In summary, chronic urinary retention happens because of blockages, muscle weakness, nerve damage, or medication effects. These factors prevent the bladder from emptying completely, leading to urine buildup. Understanding these causes helps in managing the condition effectively. If you experience symptoms like difficulty urinating, a weak stream, or feeling that your bladder isn't emptying fully, it's essential to see a healthcare professional. They can identify the underlying cause and recommend appropriate treatment to maintain bladder health and prevent complications.